Mi queridísimo Jaime, how are you?
Oye, Doc, tú eres como rockstar. So you're like a rockstar, Doc.
Why?
Pues porque no sé, todos tus social media profiles y todo. ¿Dr. Shaps is your nickname or there were too many Dr. Shapiros on Instagram?
Let me tell you the truth. It comes from my mom.
Nice.
My mom calls me all the time Chaps, and my friends in Mexico call me Chaps, and in Dr. Chaps.
Me encanta. ¿Cómo estás?
Ay, qué gusto
Nice
verte.
meeting you.
I haven't seen you since the pandemic, actually. The last time that I saw Jaime was an amazing, we were talking about mental health.
Claro.
Probably actually 2019, December.
Maybe it had to do with my movie, perhaps. The
That's,
character I was playing, no, not pulling strings, perdón. My Boyfriend's Mets.
that's the one.
Exacto.
That's exactly the one.
¿Cómo estás, Doc? Oye, thank you so much, porque sabes que hay tantas cosas. There's so many. Are we doing this in English? Are we doing in Spanish, in Spanglish? ¿Cómo lo
Spanglish.
hacemos?
I think that they're probably going to kick my tushy, but let's do it in Spanglish because I think that will be more flavorful.
I think so. And that's the way us immigrants we live in this country. We speak in English y luego nos volteamos con los compas que hablan español and then we go back to English. It's like it's how we roll. It's just how immigrants and how we roll. So yeah.
Completely. Mira, we have been hurt. We have questions. We have fears.
Yeah.
And right now we have doubts.
Claro.
By the way, let me tell you something, Jaime. It's perfectly fine for everybody to be fearful and to have doubts because I think that ese miedito has saved us against lions, tigers, sharks in the past, and we need that to run faster, but we don't need to do it the toxic way.
No, pero you know what? About the fear thing, I'm up. I appreciate being fearful and pero es que no sé, ya sabes, el clásico, which is, the vaccine wasn't tested long enough. I'm doubtful. I get it. I get that. I understand that. Pero come on. Being doubtful because people think that in Hollywood we eat babies and drink the blood of virgins. Come on, people, get real. ¿Qué les pasa, man?
That could be a movie, but you're right. You're right. I have heard about the part that like a lot of people are asking me, like, Doc, how fast was this? But Jaime, it took almost 20 years, 2 decades, to get to the point that we have. We had SARS and MERS.
Claro.
Sí.
And they correct me if I'm wrong, rDNA or whatever how you name these vaccines, they've been around. The problem, not the problem. The thing is that back then MERS and SARS, they ended. But that doesn't mean that all the research that was done before for these vaccines se fue a la basura. It's not in the trash. It just came to a halt because, let's say it, unfortunately, Big Pharma has other agenda they need to push. Let's be completely honest. Pero that doesn't mean that the research, the real doctors, the real scientists that have done all this research for these type of vaccines, they threw everything to the trash. Claro que no. It's just como que se puso en pausa. Se puso, no sé en inglés.
No.
It was put in pause.
Se puso en time out.
Exacto. Thank you.
Jaime, pero mira, one of the interesting things is that we are using the same technology against cancer and other diseases. And we even use the same technology, part of it, like the Johnson & Johnson one, to fight Ebola. Then we already know that this is safe, effective. And Jaime, déjame decirte que if we thought before that, waiting is a good game, today, after seeing what's happening on the hospitals, seeing all the horrible things that I'm hearing from family members that are intubated, and the sad part is that all of those are preventable problems. Let me tell you why. Because most of them are not vaccinated.
Claro. I have an example. I just did a show for Apple TV Plus called Shmigadun, and we were all vaccinated and whatever. Not when we shot the show because we did it in the middle of the pandemic in Vancouver, whatever. But my dear friend Ilan Shapiro, an amazing Hollywood actor, he got the vaccine, right? And he works a lot. He works in Scotland, South Africa, Australia, Vancouver, Los Angeles, whatever. He got the vaccine. He posted something on his Instagram saying, "Hi guys, guess what? I was tested positive for COVID. How am I feeling? Tremendously well because I was vaccinated. This will go away in probably 2 days." Sure enough, 2 days after, he posted something like, "Guess what? I got tested and now I have negative news, which is I tested negative for COVID. Pero el COVID no le hizo nada porque tenía la vacuna. Yo estoy vacunado desde marzo, igual que mi esposa. Tenemos menos miedo. We are less fearful than to travel. Of course, we use the mask and of course we take precautions because we are not dummies. And the vaccine, as you know, no es algo mágico que de repente ya... Es como when you get the flu shot, right? You might get the flu, I mean, right? Pero en este caso lo tienes mucho menos fuerte, como fue el caso de Ilan Shapiro, my friend Ilan Shapiro. Es impresionante. Puso un post almost laughing about it. And then you have these people going, they were like anti-vaxxers or whatever. They're in the hospital saying, please, people, reconsider. Don't believe social media. Don't go into this rabbit hole of conspiracy theories because I am alive because of a miracle of God. And I should have taken the vaccine because if I would have taken the vaccine, no estaría aquí, intubado, fighting for my life.
I completely agree with you. And the best example, because a lot of people ask me, you're like, Doc, I'm going to get vaccinated, but I'm here right now. People are getting sick anyway with the vaccine. But that's not the thought. The train of thought, la idea completamente is like vaccines are your seatbelt.
Exactly.
You're putting your seatbelt on a car not to look for accidents and to do like crazy stuff on your car. It's like in case of something horrible, una catástrofe, something horrible happening, you're not flying away from your car and like estampándote en la acera, and you survive. And that's the idea of it. It's like in case of COVID, you will survive and you do not end up with like complications, intensive care unit, or dying.
Claro. No, y luego yo escuché de un compa, un muy querido amigo mío que trabaja, me hace el favor de ayudarme con mi jardinería. He's kind enough to help me with my gardening. And he was like, no, Mr. Camil, porque I heard, maybe you've heard this one, but this is a good one. I've heard that if you get the vaccine, your tongue will swallow and then it will fall off. And I'm like, what? Es como, ¿qué? It's crazy. Y no te encanta la otra que dice, no, this is one of the best. I appreciate this because I love aliens and I love the ancient aliens, the theory and everything. So this is, even though it's nonsense, is one of my favorite ones, that we are being tracked. I'm like, people, we all have cell phones. Exactly. I'm like, we all have cell phones. You are already being tracked. Watch. Every time you see, listen, I have an RV, right? So I'm like, I search for RV accessories or RV parts, whatever. Within an hour, I'm getting on my Instagram feed 15 RV sites. It's like,
exactly. And you know what's the funny part is that at the beginning we didn't have data, and that's real. And things were changing. We were like hearing crazy stuff, but it has been 18 months, Jaime. 18 months. This is the moment that we have the data. We have seen, we have vaccinated more than 165 million people here in the US.
Yeah.
We have 3 shots, Moderna, Pfizer, and Johnson & Johnson. By the way, they actually know if they're actually helping against the Delta variant, that is changing all the rules, and they are helping.
Yes.
And apart from that, the side effects have been, in general terms, we're tracking those. Yes. Are they side effects? Yes, of course we have side effects. But for me, I prefer to be vaccinated than actually have like the front load punch from COVID-19.
Pero son insignificantes. As you know, I heard that the guy that had a very bad reaction wasn't even to the vaccine. It was because you have to look at me trying to be a doctor. Ready? Please bear with me, doctor. Por favor. O sea, don't make fun of me. Don't, no me hagas ver qué tan tonto soy y qué tan poco conocimiento de medicina tengo. But what I've heard is that you enclose en un lípido o algo la información genética de la vacuna y que las personas han generado un poco de ¿cómo se llama? Reacción. Una reacción al lípido que envuelve la vacuna. No es a la vacuna. Es algo muy específico, no? It's something very specific. And again, it's insignificant. Just like what happened with Johnson & Johnson. I took my friend, Cristian Castro, the singer, to get vaccinated. He doesn't like shots, so he was like, dude, I just want the one shot, Johnson & Johnson, boom. The next day, the stories about women, like, yes, we had bought, I don't know how many millions of vaccines, and they had 6 cases. of women that develop algo de anticoagulante or something like that.
I have a live question for you. Ready?
And Christian, I'm sorry. I shouldn't have said who is it, but I'm sorry, Christian. I love you. And then Christian called me very concerned. I'm like, Christian, to my knowledge, you are not in the female group, and you are not within that age. So I think you're good.
Let me tell you a couple of things. It's you're completely right. You're completely right. And what do you think that is more common? And that we all take risk every day. Like, do you want water or something else? Are you eating okay or are you doing exercise? And we take risk all the time. Do we go to the right side, public, whatever.
Yeah.
But on reality, it's more common to get struck by lightning right now, right? Like now, like live from LA Care between Shapiro and Jaime Camil, than actually having a problem with one of the vaccines that we have.
100%. It's I heard that also statistically you're more likely to get in an accident or recibir more damage from an accident inside of an elevator. Like, imagine the elevator like fails and falls to the ground. That's more likely to happen than have the vaccine. Bueno, I have some questions that I have to ask. I have to, and I want to ask you, Doctor. Also, shout out to LA Care and Inland Health Empire. Am I pronouncing it correctly, or is it Inland?
You're good.
Inland. What is the H or the E first?
EH.
Inland Empire Health. Something, and then LA Care Health. We love you guys. Thank you for putting this together and for everything you do to really put the information out there and to help everybody understand what's behind the vaccine situation, right? So, ahí te va, Doc. As of May 10th, 2021, the FDA expanded the emergency use authorization for the Pfizer COVID-19 vaccine to include adolescents. ¿Estoy pronunciando correctamente adolescentes?
Perfect.
Adolescents, 12 through 15 years of age. How about my kids, for example, Elena, who's 9? When will Elena is so funny because she's like, I want to get the vaccine now, and I'm like, dude, you can't. Easy. Let's see what Dr. Shops has to say. Pero cuando los niños abajo de 12 años, when will they be able to get the vaccine?
It's a beautiful question. Right now we have Pfizer that's 12 and above.
Yeah.
And right now we're looking for, with the Pfizer and Moderna, they're actually right now doing the research right now. And I really wanted to have good news before we went back to school in most of the US. But probably by December, kids from 6 months of age until 12, they will actually have that.
Oh, from this December of 2021.
That's the hope that all of us are praying for that. Porque tengo dos chamacos. Que se apuren.
Oye, es que a ver, we have to deal with everybody. When we go to school, I mean, God bless their souls, but we have families that are, pro-vaccine and families that, I don't know, they are not pro-vaccine. So you have to take care of them. Y claro, la siguiente pregunta, me imagino, claro, dice, how well does a vaccine work in adolescents? Of course, it works equally as good as in adults, right? Equally as effective.
Jaime, let me tell you the background on that question in my mind.
Cool.
In the old days, meaning like 2 or 3 months ago, when all the data that we had eran otras variantes, no era la Delta. Delta vino aquí a rompernos la cara. The Delta variant right now is coming to change all the rules. And we knew in the past that kids were kind of protected. That's what we thought.
Es cierto,
right?
Es cierto. You're right, because kids didn't, even they were saying that kids, like, maybe o sea, como que no les afectaba el COVID. They weren't affected by COVID.
I know, but with the Delta variant right now and probably other stuff that we're exposing more of the kids, they are getting sick. 15% of the, they look weird. 15%
Wait,
of
51? What?
Lost in translation.
Okay.
15%. 15.
Okay, got it.
Of kids of cases in the U.S., new cases are actually in teenagers and young kids. Then that's the gran problema que tenemos, the big problem that we're having. That's why if you get the opportunity to vaccinate your teens and your kiddos that are 12 years in age, do it.
Por cierto, let me tell a toda la gente que nos ve, send your questions because at the end we're going to have a little time Like, for example, there's a question here that maybe has to do with what you were saying. Que si van a haber ajustes, are there going to be adjustments to the vaccine for every variant eventually? Do you think that's going to happen eventually? Because right now we are protected from the Delta variant with the vaccines we have currently. But do you think vaccines will eventually, they tweak them a little bit to, to address all the little variants we're going to have eventually? Yeah, sure, right?
Let me tell you what they are thinking and the examples of other vaccines and where I think that we're going. Right now, we have the conversation about the CDC and the FDA that is asking us to get vaccinated if we have problems with our immunity. And that's not all of us. That's for the third dose. Then that means that if you have Pfizer or Moderna, 20 days afterwards, if you have like a renal transplant, a heart transplant, a liver transplant, or certain autoimmune diseases, you will be eligible to get the third dose. That doesn't mean right now for all of us. We need to measure for the third dose for all of us. We need to think two things. One is that are the vaccines that we have right now are fighting against the new variants? And right now, they are. They're helping us.
Yes.
The second question is how long the memory of our body will continue to produce antibodies. ¿Cuánto tiempo se va a seguir produciendo esos anticuerpos en nuestro cuerpo? And right now, for example, Pfizer said 8 months. Moderna hasn't said clearly where they are.
That's the one I got.
But if everything's changing, probably yes.
Okay. I don't mind getting a boost. Nos hicieron una pregunta de los side effects. I can answer that one because I had some. My wife had a little redness on her arm, and she was kind of tired the first dose. Me too. It was kind of tired. I had to take a 2-hour delicious nap, by the way, and that's it. And then a friend of mine told me for the second dose, me dijeron, drink Pedialyte, not the small bottle, but the next size up. Me dijeron, tómate 2 de esas to keep hydrated the day of the vaccine, and 4 days after the second dose. Doctor, santo remedio, ¿eh? No sentí nada, porque un amigo me había metido el susto de que no, la segunda dosis is gonna knock you down y bla, bla, bla. Yo estaba, no puede ser. No sentí nada. El Pedialyte, y a todo el mundo que le decía, oye, me dijeron del Pedialyte, a mí me funcionó, me los encontraba a los 6 días. Dude, the Pedialyte thing you told me, incredible. So if you're getting vaccinated, if you're going to get the second dose, drink Pedialyte. Why is that, doctor?
Mira, la idea en general es estar hidratado. It's very important to be hydrated. And then, what's the important thing right now is that everybody has different things about side effects, right? There's people that do not feel anything and they go like, oh my God, my body's not working. We are all responding a different way, but I share with you, me eché yo también una siesta de 13 horas. Buenísima.
No, 13 ya es holgazanería, ¿no? Ya es de flojo.
Sucedió y estaba, ya sabes que nosotros como hombres somos, estaba más doloroso, entonces le decía a mi mujer, no, es que necesito más tiempo, recuperación, y así, but the important thing is everybody needs to remember 3 things. This is free for everybody, and you do not need insurance to get it. Okay. Aquí, no necesita nadie de ustedes, seguro, es gratis y es para todos, ¿no? Y realmente es lo que queremos hacer. Jaime, te voy a hacer una pregunta así medio secreta.
Claro.
Sé que ya estamos como en 20 minutos.
No te preocupes. Si tú tienes tiempo, yo tengo tiempo. ¿Tienes tiempo?
Perfecto.
Bueno, déjame decirte una cosa. Aquí decía, many parents are wondering, ya lo contestamos, but I want to address the question. No? Many parents are wondering if their children need the vaccine because they heard their children don't get very sick, infected. Yes, ya contestó el doctor. The doctor said that yes, indeed, for the previous variants, the previous variants didn't affect the kids as much as the Delta variant. Now 15% de los niños are getting sick. And we've seen stories on the news about that. Even know that some parents still choose, even knowing that, some parents may still choose to not vaccinate their children because they're afraid the vaccine will impact their child's development. Esto es importante, Doc. Aquí tengo 2 preguntas. Is that something parents should be concerned about? Te pregunto porque se ha dicho también que si la mujer está embarazada, they shouldn't get the vaccine because it might affect the fetus. Pero obviamente, ¿cómo está eso? ¿Qué niños se afectan? ¿Qué no se afectan? ¿Y afecta el development del child? Yes or no?
First of all, pregnant women that are actually giving breastfeeding, yes, you can actually get vaccinated before we were very kind of, like iffy because we didn't know, we knew because of information that we had before that there's really no issues, but we wanted to make sure. Right now we know, and the American Academy of Gynecology and Obstetrics have actually approved the vaccine, and the FDA and the CDC to actually give to any trimester. Then if you're pregnant at any point of life, it will not harm you or your baby. That's what they are seeing. They have done research. They have seen, if it creates more problems for mom or the baby or complications after birth. Nada, zero, zip. It's the same as baseline. If there's going to be a problem, it's the same way if you get the vaccine or not get the vaccine. But you will be protected against COVID-19.
Okay.
Otro lado.
¿Hay algún site de LA Care o de Inland Health Empire? ¿Hay algún site que recomiendes para que si tienen más información, if you want more information about Serena Bell, Pedialite, le decimos Pedialite en inglés porque suena más fancy, pero es Pedialite. Me está preguntando del nombre de la bebida para hidratarte. ¿Qué sitio pueden visitar? What's the website they can visit in order to get more information about the pregnancy and stuff?
Directamente googlean a la de LA y también la de Inland Empire y directamente están ahí, y prometo que voy a hablar con los equipos de comunicación para que tengamos información a otras ligas, tanto de la CDC, y que hagamos lo mejor posible para ustedes, y recordando también la otra parte de los efectos secundarios en los jóvenes. Déjame decirte, Jaime, I'm a pediatrician, but also I'm a father of two.
Claro.
Then I'm going to share something that it's kind of on the private side, but I think that everybody needs to hear it. I'm choosing to vaccinate my kids, and I'm telling you the process that I did, the whole thing. You have COVID-19 on one side and the vaccine on the other side. You need to choose which one will actually save or protect your kids. We want our kids to be protected no matter what, and we will fight for it. Yeah. And the same thing right now. We need to have that feeling that we're looking for the best thing for our kids. Right now, we know with the kids that are, 15% of the new cases are in kids and teenagers. We know that there's like this weird inflammatory disease called MISC-C that can actually happen after survival of COVID-19 in kids, and they throw them to the hospital. Also, thanks God, the mortality rate is very small in kids, thanks God, but they can still get long-term effects like brain inflammation, problems with the heart, epilepsy, and other stuff. It's like more than 50 things that they can have long-term. Then I don't want that. All right. On the other side, we were talking about the side effects that we have on the vaccine. We need to kind of measure the whole thing. Right now, if you get, the infection, COVID-19, from 100 people, 4 to 5 will actually get inflammation of their heart. 5 to, from the vaccine is 0.001%. And a lot of parents were like, oh my God, the inflammation of the heart of my kid. Like, wait, let's measure this. If they have more probability of getting COVID-19 right now than the inflammation due to the vaccine.
Pero doctor, you're talking about people that don't do research, they get lost in these crazy conspiracy Facebook groups, and they go into this rabbit hole, and the next thing you know, I stopped here. I don't mean to interrupt you. I'm sorry, but I stopped here with this, and I love to address people with this nonsensical, with all due respect, at least is my opinion, these nonsensical conspiracy theories, because they will argue with all the security that only ignorance can give you, right? And it's like, what about all the people, that's the question, what about all the people who have ended up paralyzed after the second shot? Where do they come with this? Like, where do they read these?
It's a good question, and sometimes, and this actually, like, for everybody that's hearing us, les voy a decir un par de tips para cuando vean que es pseudociencia y que sea misinformation, para que busquen ahí when you hear this, it's misinformation. There's a lot of articles out there that look and sound like pseudoscience. They tell you, like, and they will always go like to the extremes. They will tell you like vaccines are bad, the virus is a hoax, and all that stuff. But when you start hearing that part, just be worrisome. The second thing is that who is actually creating the article? Is it a doctor? Is it a doctor in philosophy? Is it a medical doctor? Because there's a lot of doctors, but not a lot of doctors actually know about COVID-19, and not a lot of doctors are medical doctors. And be careful with that one. The third one, a lot of the times they will try to sell you a lot of crazy things. Then right now, familia, the best thing that you can do is vacunarse ya. and make sure that that's the best thing that you can do right now in order to protect yourself and your family.
No, sin duda, sin duda. Aquí también había una que decía, bueno, ya contestamos esta, que sí es, many people think, lead to infertility, ya dijimos que para nada.
De hecho,
Sí,
déjame decirte algo
sí.
de sexualidad, porque esto es importante. Hombres, escuchen esto.
No,
If you
doctor,
get-
no me interesa saber nada de tu vida sexual. No,
No, no,
gracias.
no, 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 no,
Oh,
no, no
oh,
voy a aventar
oh,
aquí
okay,
en el aire libre. Pero las personas que les dan COVID-19 pueden tener disfunción eréctil. Hear me out. People that actually get, talking about fertility and sexuality with
Me voy a vacunar
with-
4 dosis más, con permiso. No, no es cierto.
Exactamente. Entonces, anybody that actually has COVID-19, they're getting closer to erectile dysfunction. We have seen this. Porque todo es, cuando llega el virus, afecta la vasculatura. When you have the virus, it actually inflames a lot of the vasculature and the blood vessels that you have around your body, and can actually lead to other stuff like that. Then, señores.
Oye, people have chronic illnesses like heart disease or diabetes. Is it safe for them to get the vaccine?
Yes, yes, and yes. And let me tell you why. Right now, we are seeing if you have chronic diseases, you have a higher rate of problems, meaning that you end up on the hospital, complications, and long-term effects, and you're getting close to death. Then, please, a lot of people get, like, Doc, I have diabetes, I have this, I have that. Then...
Doctor, me encanta cuando dices please, porque the subtext is like, please, don't die. Don't choose to die, please, or get seriously ill. We know the mortality. That's another thing they say a lot. No, but the mortality rate isn't that big. How big is enough? Like, ¿cuántas quieren? O sea, debería de ser 0. Pero te interrumpí. Perdón, es que me encanta por favor.
Es justamente la cosa. You know what? It hurts me the most right now that as a doctor, my oath is to help anybody, no matter what you do and what problem you will have me. That's my oath. O sea, mi promesa como doctor es, no importa de dónde vengas, qué hagas, pues, yo no soy juez, y yo vengo aquí a ayudarte. Pero si tenemos realmente enfrente de ti la solución para protegerte a ti y a tu familia, if you actually have in front of you a solution that will protect you and your family, and maybe you don't like your family, at least yourself, like, why not use it?
Sí, de acuerdo. No, mira, a mí no me tienes que convencer. Yo me vacuné desde marzo, o sea, yo estoy feliz de la vida. Pero a ver, ahí te va esta. Ok, ya hablamos de los side effects, de los vaccines. O, ¿qué tal que alguien ya tuvo COVID-19? ¿Se puede vacunar después de tenerla? Claro que sí. He sabido de muchos datos y casos que sí, ¿verdad?
Completamente. If you already got it, you need to wait 10 days. If you already got COVID-19, you need to wait 10 days in order to get vaccinated. That's it.
Preguntan mucho acerca de las 3 dosis. Yo voy a decirles mi caso personal. Yo me puse ya las 2 dosis de Moderna y a lo mejor puede ser que haga un proyecto, no sé, en noviembre o algo así. Me voy a poner, la necesite o no, que creo que sí, me voy a poner una tercera dosis antes de noviembre. ¿Me lo recomiendas, Doc? ¿Que me ponga una tercera dosis en noviembre?
Yo voy a estar contigo.
Ok.
Yo no te voy a dejar en paz. No, ¿tú qué crees? Que no, eso sí, si se necesita. La cosa es que the same way to protect ourselves, we need to continue reminding our body that we need those defenses. O sea, necesitamos recordarle a nuestro cuerpo que necesitamos eso. Entonces, cuando nos digan, we're good, está el research allá afuera, hay que preguntar definitivamente, muy importante, siempre hay que preguntar por qué 3 veces. And if we're good, ahí voy a estar contigo.
Buenísimo. Aquí me hizo una pregunta a un usuario. I have a question after the vaccine. Si tienes esta reacción de rojito, is it best to move your arm around or don't move it at all?
Move it. Move
claro,
it.
porque you want the... Claro, sí, ok.
Porque muchas veces te dejas ahí, se inflama más. Eso sí, you can use some ice packs. Sometimes you can use some warm compresses over there.
Claro.
And that's about it. And
la tercera dosis te daría un side effect similar to the previous ones? Yes, because it's the same thing, right? Or maybe your body is more used to it.
Vamos a ver, generalmente no debe haber una reacción mucho mayor. Tenemos muchas vacunas. We have a lot of vaccines that we give like a 3rd dose or a 4th dose, and usually it's kind of the same, profile.
Sandra dice sobarse. Dice una sobarita para que se... Ok, how long does it take? I think I know this one. Let me see. How long does it take the COVID-19 vaccine to reach maximum effectiveness? Is it 14 days after the second shot?
What a beautiful question. Okay, yes. Second shot, around 2 weeks. That's the peak. That's where you're fully covered.
Okay. Okay. Is it important for fully vaccinated people to wear a mask? For the love of the creator, yes. I'm fully vaccinated and I wear a mask. I always wear a mask. Not always, to be honest. Not when I'm out and about. You know, I'm not that awkward person that thinks that the vaccine will do nothing to you. I definitely wear a mask, but it's mask as a sign of respect to others, because I don't want to go to a place where say like, oh, we don't wear masks here. What am I? I'm going to be asking around, excuse me, sir, are you vaccinated? Excuse me. I don't care, because I don't care and I don't want to get in their way. I just put my mask and I'm happy. Por eso lo hacemos en aeropuertos todavía, porque hay muchísimas personas que no están vacunadas y muchísimas personas que no creen en la vacuna. ¿Y para qué los molestas? Te vas a meter a un problema político, porque for some reason masks and vaccines se politizaron for God knows why. Entonces mejor no te metes en esa conversación o en esa ¿cómo se llama? Discusión, y te pones la mascarita.
Yes. Y es justamente la idea. O sea, muchas veces ahorita que los niños están regresando a clases, mucha gente me decía y digo, ahorita en California queda claro que sí ha hecho una gran diferencia. De hecho, en todo el mundo, cuando no había vacuna, justamente lo que era la mascarilla era lo que nos salvaba. La mascarilla, lavado de manos, distanciamiento social, y es justamente, y estaba leyendo esto y quiero agradecer a uno de mis compañeros, mandó algo así que te quieres tú poner como cuando va a llover, quieres ponerte, o sea, la chamarra, quieres ponerte el paraguas y quieres tener lo más posible encima para que no te caiga la lluvia encima. Claro. Esa lluvia es el COVID-19. Tienes que tener diferentes niveles de protección. You have to have different layers of protection to make sure that you are good, your family is good, and you're protected from the rain. And that's the best example that I have heard. And that's why we need the vaccine. Why we need.
Oye, the Berito hace una pregunta muy específica. My daughter had Guillain-Barré, se dice, as a child. Am I pronouncing this?
Guillain-Barré.
Guillain-Barré as a child. Can she have the COVID vaccine?
Definitivamente, te voy a platicar. No puedo hablar un poquito de caso específico, pero en general, no hemos visto que las personas que ya tuvieron Guillain-Barré se les repita después de tener la vacuna. Okay. No es una contraindicación de las vacunas que tenemos aquí.
All right, perfect. Y bueno, las máscaras, usen máscaras, people. Come on, just don't be. Can I say a bad word, doctor?
I'm going to do this.
Don't be assholes. Come on, wear the mask. Wear the mask. ¿Qué les cuesta? Aparte me encanta porque cuando vas a LUSD a la escuela, yo que tengo hijos, te piden un vaccination card, ¿no? Que tengas las vacunas normal. Y para eso no tienen problema, ¿no? Ah, no, esos están bien, güey. Que me pidan mi reporte de vacunas para esas. Pero esta no. ¿Cuál es la diferencia? Es una vacuna que se necesita ahorita porque estamos en medio de una pinche pandemia.
Jaime, ¿te acuerdas también, o sea, el momento que la gente fumaba en los restaurantes, en el avión?
Claro.
La gente, yo digo, tú y yo vivimos lo mismo, que nuestra mamá usaba el cinturón de mano, porque no había cinturones de seguridad en el coche. Sí. Entonces, todas esas cosas son porque
y te sentaban adelante, no te sentaban atrás, no había child seats. A mí me ponían hasta atrás, no que esté tan viejo, Edo, pero medio me acuerdo, que me ponían en la cajuela del station wagon. Ahí me aventaban como pinche res. ¿Cómo? O sea,
y por eso, that's why, you know, like, one of the interesting things is that the vaccines right now have been very, very finely researched. O sea, todo lo que tenemos ahorita lo están viendo con la lupa. They are actually with magnifying glass. A comparación de otros medicamentos de pastillas azules y otras cosas más que están por todo el mundo y todo el mundo se los toma y nadie pregunta qué efectos secundarios tiene. Y ahorita que ya tuvimos una vacuna, a vaccine that was truly researched, it's safe. We have seen actually 170 million people actually got the vaccines. And familia on the hospitals, y se lo digo, for myself, my friends, my colleagues, my nurse.
You're back.
For my doctors, for everybody that is actually right now in healthcare, do us a favor. It's not like COVID-19 calls diabetes and cancer. Go like, oye, I'm not coming. No worry. I'm not going to ICU. Don't worry. You can say, guys, no. There's accidents. There's people that have cancer. There's people that have a lot of things. Then,
Claro.
When we're using ICU beds for COVID-19,
le estás quitando la cama a alguien que sí lo puede necesitar. ¿Y por qué se la quitas? Porque este knucklehead decidió no vacunarse. ¡Dude! O sea, ¿qué pasa, mano? Oye, y una pregunta, pues Doc, a ver, first of all, thank you for all of this information. Hopefully we did a service to the people with doubts, with questions. Thank you, LA Care. Thank you, Inland Empire. Gracias to put this together. Gracias, Dr. Chaps, por ayudarnos. Eres lo máximo. Estudiamos en la misma escuela, por cierto, en la Náhuac. I have one more question. How and where can folks get vaccinated? Porque listen, if we convince one person in this Instagram Live, I'm going to be happy with that. Entonces, si se quieren vacunar, ¿a dónde van? ¿Qué site visitan? ¿Dónde es? Porque yo me vacuné cuando era extremadamente no complicado, pero había una lista larga de espera y era era como que, y ahorita creo que ahorita me duele, me entristece mucho escuchar historias de que CVS tiró a la basura 800 dosis porque no llegaron. Y hay países tercermundistas que se están muriendo por esas dosis. Y por favor, people, let's not waste them, ¿sabes? O sea, es que qué privilegio y qué honor y qué fortuna de Dios tenemos de vivir en este país y que gente no lo aproveche, Doc, y que se tiren esas dosis a la basura. It breaks my heart. It really breaks my heart. Entonces, ¿dónde se pueden vacunar?
Bueno, familia. First of all, it's free. It's for everybody and you do not need insurance. Eso es para todos, es gratis y no necesitas seguro médico. Muy importante para todos.
Ni tampoco te preguntan tu estatus migratorio, papá. Ni tampoco les importa qué estatus migratorio tienes en este país. Les vale gorro, no les importa. Que te importe tu salud.
Y te voy a decir por qué. Porque este virus le vale madres a quién amas, a quién no amas, de dónde vienes, qué comes. This virus doesn't distinguish if you love someone or you eat something or what you speak. Just if you're a human, you're a target. Si eres humano, te va a atacar a ti. Entonces, pueden ir a cualquier farmacia prácticamente, clínicas comunitarias, también con tanto en Inland Empire y también con LA Care. Estamos haciendo drives y vacunación en la comunidad. Entonces,
nice.
por favor, vayan a hacer eso. Y es prácticamente, llegas y te la ponen. O sea, antes era que dabas ahora sí tu huella digital y tu primer hijo. No, ya no. Ya lo queremos realmente para que lo podamos usar en cualquier momento. Y estamos tratando de hacerlo lo más fácil para cada quien de ustedes. We are actually doing this as simple as possible. That way you can actually go to work, protect your family, and be healthy.
Así es, Doc. Yo ya acabé. Si tienes una pregunta para mí, shoot, pero I'm good.
Pues ya platicaremos para la tercera dosis si es que pasa y nos tomarán la foto así de
así, con el brazo todo rojo, ¿no? Así de oh.
Echando la siesta de 13 horas.
Oye, Doc, gracias. Mira, yo, por si me preguntan, sí me vacuné. ¿Por qué me vacuné? Para la seguridad de mi familia, de mi comunidad, porque creo en la ciencia, porque creo en los doctores, porque obviamente tenía dudas de una vacuna, todas las mismas dudas que tenemos todos. Oye, pero no la probaron tanto, pero no sé qué. Y me puse a investigar. Y me supe, como decía el doctor al principio, que en SARS y en MERS se adelantó bastante la tecnología de estas vacunas. Luego se puso en pausa, pero luego siguió. No es una vacuna que están haciendo de la nada. No están haciendo no. Viene mucho research atrás. Y a los que decían que se necesitaba más gente vacunada, híjole, Doc, ya tenemos a más de 170 millones de americanos vacunados. O sea, más pruebas no se pueden hacer. Y sí han habido casos minimísimos aislados de algunos side effects que han surgido, pero son el que 0.000, o sea.
Mira, todo es un juego. La vida es un juego del azar, pero hay que jugar a ganar. Esa es mi filosofía.
Claro.
Mi filosofía completamente es eso, y por eso tanto LA Care y también el Inland Empire Health Plan están haciendo absolutamente todo para que todos nosotros estemos mejor protegidos y no terminemos en el hospital, y no terminemos con oxígeno, trasplante del pulmones, ¿sabes qué? Una de las cosas que más,
Cuando bien te va, ¿no? Porque te
sí,
puedes morir también.
a mí me daba pánico cada vez que yo salía de mi casa antes de la vacuna. Todavía tengo mucho respeto al COVID-19, pero ahora tengo un efecto secundario de la tranquilidad de estar vacunado. Por eso definitivamente nos tenemos que vacunar todos, y parte de esto es vacunarnos contra el miedo con una dosis de verdad.
Así es, Doc, gracias. Hay muchas preguntas que están haciendo que ya contestamos de hace 40 minutos que empezó el live, así que les recomiendo que luego visiten este live. Me imagino que el Doc lo va a subir al feed de LA Care Health, así que ahí lo pueden checar. Pero Doc, por mi parte es todo. No sabes cómo te agradezco. Espero que volvamos a hacer un Instagram Live más adelante para ver cómo nos fue con la tercera dosis. Pero de veras, muchísimas, muchísimas gracias. Thank you a toda la gente que sigue preguntas. Visiten este live, como les digo, el doctor lo va a subir a la página de LA Care Health y ahí va a vivir este live para que si tienen dudas, pues así como se meten a sus locuras de conspiración del Facebook, también se metan en este live y lo chequen y lo escuchen y ojalá podamos hacer algo bueno para la comunidad y para nuestra gente. Doctor, I loved it. We went English, we went Spanish, we went Spanglish, then we finished all in Spanish. O sea, what is wrong with us? Pero we did it.
Thank you so much, Jaime. And as always, I'm here. Y familia, you heard from those two people that are not just someone that is just in your Instagram feed. We are humans. We have families. We have that connection of the same things that all of us are struggling. We need to connect. We need to go back. And again, familia, we need to start vaccinating ourselves against fear with a dose of truth. Familia, vacúnense ya. Cuídense mucho.
Gracias, Doc. Cuídate mucho. Que tengas buena semana. Thank you.